When someone calls 911, it's arguably one of the worst days of their life. As a fire district, Metro Fire, we want to be there for the community every single day, and we are. In the fire department, emergency medical services is set up to be ready for the call. So it starts well before that with training and experience and vehicles and all of the things to support the readiness. Once the 911 call is made, it goes to a call center. It gets triaged, questions get asked about what the call is about to classify it correctly. Once it's determined on what type of call it is, you'll get a first responder unit that will be dispatched normally as a fire engine or a fire truck or a squad unit, and they would be dispatched with an ambulance. All of those things happen within the first 60 to 120 seconds of a phone call being made, and then the doors go up on the fire station and they show up to do what they do every single day, which is a high level of emergency medical care to the community members that are calling. And that's what the community deserves. The fee study itself reviews what the overall cost of providing the service, which includes administrative staff, the training of our personnel, buying of the equipment, the medications that we need to have and administer to people that call, recurring training that goes on, and then the actual response itself. What is it that it costs us to provide that service, and how do we recover that cost? Because we're also not for profit. And I'm happy to say that in this last fee study determined that our costs are right in alignment with where they should be. But it did identify some areas that we should be looking at recovering costs. Looking into this fee study, the Mobile Integrated Health program that we've been running for the last few years on grants allows us to respond with a paramedic and a physician's assistant or a nurse practitioner to calls that we know haven't necessarily resulted in transports, but still needed a level of medical care. So with this new fee structure, we're able to now understand what the cost recovery would look like. We need to do better and be able to sustain that because it saved millions of dollars. We don't want it to go away. To the average citizen, not a lot will change. A high percentage comes from insurance reimbursement because they know that this is where we need to be paying to make sure our patients are getting the right level of care. The additional things we've done with this ordinance, however, is to work closely with our membership, our board, our community, to make sure that there's processes for those folks that maybe are in a place where financial hardship is an issue, or that there's some sort of compassionate billing that needs to be considered. We never want to have an impact on our community that they're thinking about not calling 911 because they're worrying about getting a bill. Our members are professional, highly trained responders that are there to take care of the community. When someone calls on their worst day and it's a life and death situation, we're able to provide that level of service 24 hours a day, 7 days a week, 365 days a year.